Borderline personality disorder, or BPD.
What is borderline personality disorder? Let's discuss the history of BPD.
1938, Adolf Stern lists most of the diagnosis criteria and calls the group of people affected the borderline group. 1941, Gregory Zilborg describes the disorder as a mild version of schizophrenia. 1942, Helene Deutsch defines a type of people dependent on others' personalities as having as-if personality. 1943, Robert Knight introduces ego psychology and describes patients as being in borderline states. 1967, Otto Kernberg defines boundaries between psychotic and neurotic, and he places borderline personality in the middle. 1968, Roy Grinker does the first research on borderline personality disorder. 1975, John Gunderson publishes research to help diagnose BPD. 1980, BPD is included in the DSM-3. 1993, Marcia Linehan introduces dialectal behavior therapy, DBT, as an effective treatment. 1994, DSM-4 is published, defining further the symptoms of BPD required for diagnosis. 2008, the U.S. House of Representatives declares May as the National Borderline Personality Disorder Awareness Month. Current research continues to advance the field. The current criteria in the Diagnostic and Statistical Manual of Mental Disorders for borderline includes 9 symptoms. The first symptom, and usually most prominent, is a fear of abandonment. This fear of abandonment is one of the main reasons individuals living with BPD struggle to maintain healthy relationships. The fear often leads to frequent requests for reassurance, even resulting in the individual to go to great lengths to avoid real or imagined feelings of abandonment. The second symptom is impulsive behaviors. These behaviors are thrill-seeking and risk-taking behaviors without regard for consequences. The third symptom is chronic feelings of emptiness. Chronic feelings of emptiness were experienced as a feeling of disconnection from both self and others, and a sense of numbness and nothingness. The fourth symptom is explosive anger. Anger that is intense, uncontrolled, or inappropriate can be a devastating symptom for someone struggling with borderline personality disorder. It can be difficult to try and handle the rage as it is occurring. The fifth symptom is shifting self-image. Self-image, what a person likes and dislikes, are constantly shifting. This usually leads to the individual to appear overly sensitive. The next clip will contain mentions of self-harm. The sixth symptom often associated with BPD is self-harm. Individuals coping with BPD may resort to self-harm. This behavior often occurs as a way to self-soothe due to the intensity of emotion one may be feeling. The seventh symptom is extreme emotional swings. Similar to explosive anger mentioned earlier, extreme emotional swings is very common in BPD. The rapid changing of moods can be daunting on the loved ones of an individual suffering from BPD. The eighth symptom is unstable interpersonal relationships. Interpersonal relationships can be very difficult to maintain. The intense sensitivity to changing plans, assumed feelings of rejection, and other distortions can lead to someone with BPD breaking off friendships. They often feel like no one genuinely cares for them, and sever the relationship before they assume the other person will. The ninth and final symptom is paranoia. The paranoia aspect can be confusing. It usually falls into the suspicion loved ones are not who they appear to be, normally malicious intent, even if there were no actual changes to the relationship dynamic. This can also lead to self-isolation. Now let's discuss treatment options for BPD. Before we talk about the successful forms of treatment, it is important to mention the failures that paved the way for better management of BPD. Traditional forms of therapy, similar to cognitive behavioral therapy, was not effective for the treatment of borderline personality disorder. The reactive responses someone may be struggling with are due to the rational part of the brain being ignored when triggered. Individuals with BPD are highly sensitive to criticism and do not handle traditional therapy approaches in a healthy manner. This interaction would result in a negative point of view of their therapist, and the patient would no longer feel safe. The biases surrounding BPD can make it very difficult for a person to find the right help. A lot of therapists do not want to work with BPD patients because of their black and white thinking. Black and white thinking is known as splitting. Splitting occurs when a person with BPD highly idolizes someone, then suddenly deems them unworthy. Another discouraged treatment for BPD is benzodiazepines. We now know that specific medications worsen symptoms, especially anti-anxiety medications. They are reported to have increased suicidal ideations. If traditional therapies did not provide a sense of relief, and medications worsened symptoms, how did we discover how to effectively treat individuals? Dialectical behavioral therapy is the most efficient form of therapy for the treatment of BPD. A crucial person responsible for effective treatment of BPD is Marsha Linehan. In 1971, Marsha Linehan was a suicide researcher who had no familiarity with borderline personality disorder. When Marsha learned of borderline personality disorder, she had already been battling her own mental illness after being diagnosed with schizophrenia. She began researching BPD and began developing dialectical behavioral therapy. Dialectical behavioral therapy, or DBT, combined acceptance and mindfulness. People must accept things for how they are. Change is necessary for growth and happiness. DBT was the first psychotherapy to formally incorporate mindfulness. DBT consists of 4 main components: a skills training group, individual psychotherapy, telephone consultation, and a therapist consultation team. The goal of the skill training group is to provide mindfulness, emotional regulation, and distress tolerance skills. The combination of psychotherapy provides the patient with a better sense of self-control. If DBT is well received and taken seriously, an individual could break the patterns of thinking, behavior, and feeling. The individual with BPD will have better ways to navigate their triggers, having found ways to manage possible outbursts in healthy manners. 93% of patients with BPD had a remission that lasted for 2 years, while 86% had remission that lasted 4 years. Individuals with BPD are deserving of love, they just process emotion differently, but are more than capable of offering a fulfilling partnership with someone they trust. By acknowledging BPD, we can give compassion to those suffering, and offer sufficient ways to help, making individuals feel less alone and more understood.